Andrew, thank you very much for inviting me. That's the first thing. Of course, as you know, I'm not an occupational physician. I am not knowledgeable about your areas of research, and my research was on fibroblasts and endothelial cells, so quite a long way away from your own interest. But in 2002, I became president of the Royal College of Physicians, and it started to change my thinking about what was really important. I had concentrated on one disease, gone deep into it, and I started to get really interested in the Marmot agenda, so what Michael Marmot had to say about the social determinants of health, and that led me to health and work. And for the last 20 years, I've tried very hard to contribute to this debate. And what I'm going to try and do is to say to you where I think we are in this country today. I will use examples from some European countries that do it rather better than we do, and to give you some of the challenges we face, which I think are probably shared to a certain degree in all countries represented here. So I want to go all the way back to 20 years ago when our Department of Work and Pensions published a very good report. For a government report, it was small, thank goodness. It didn't have many pages. It had some really sensible recommendations. So this was the vision of the Department of Work and Pensions in 2005. I don't think any of us could disagree with anything that is written on that slide there. Particularly work promoting individual overall health and well-being, people with health conditions being able to be in work, and people making the right lifestyle choices from a very early age. In this report, they also asked for a National Director of Health and Work, the first one we've had in the country. I was lucky enough to become that National Director, and the first thing they charged me with was writing a report, which many of you here today will know I called Working for a Healthier Tomorrow, published in 2008. And in that report, I was trying to look at the factors that stood in the way of good health and think about interventions that would change our attitudes, our behaviours and practice. How did we enable people to be well and in good work? And for the first time, I think I set out a baseline for the health of Britain's working age population, and showed even then, this is 20 years ago, that we were living longer, but not necessarily in good health. Now, the government accepted all the recommendations, but you should choose carefully the year in which you publish, because this was 2008, when the financial crisis was coming, and we were very close to changing our political leaders. This was written for a Labour government. Of course, we have a Labour government today, but in 2010, we had a coalition government. And when you change governments in this country, certainly they like to fiddle with policies and procedures, etc. So timing of reports are really very important. And I've often reflected that when governments change, for example, in defence, we don't change our direction. We have the same defence policy. We cannot afford to change it. So why don't we have a welfare policy that can extend over 10 years or maybe more, so that we can really do things sensibly, carefully, and use evidence? As you will see, I probably think that that is not quite what we do. I did have words to say at that time, still feel strongly about this, about occupational health as practiced, not the research side, but the practice of occupational health in this country. I felt at that time, I still feel, that it is too narrow for the challenges that the worker faces in the workplace. And I said then that it needed to relate much more to mainstream healthcare. It was rather out there on a limb as a clinical practice that didn't come into, if you like, the main body of healthcare in this country. And I really wanted the practitioners to address a much wider remit. I mean, you may disagree with me, but I thought occupational health should really be thinking much more about the mental health of workers and how they contributed to maintaining good mental health in the workplace, that they should relate much more closely to public health, to our community medicine, to general practice and vocational rehabilitation, again, working much more collaboratively with them. I wanted really clear workforce plans and I mentioned strengthening of the academic base. The one recommendation that never got a chance in my first report was a centre for research. And the Labour government had put aside money for that research centre. When the new government came in 2010, they took the money away. So we were never able to develop that strand of work. And you will see here I wanted formal accreditation for all providers, and that should be to quite a high standard. So if I try to sort of condense 2008 to 2025 and just put some of our challenges which we face in this country, I presume you may face some of them in your own countries. Political change in government is always a challenge. We had a lot of austerity, and therefore we had less investment. It's so hard under these conditions to get sustainability of any initiatives and to get consistent delivery. And you find there's often resistance to change and lack of research, which of course certainly happened in 2008. Trying to change workplace culture is difficult. And what filled the void a lot, and I don't know whether this happens so much in other countries, we've had an enormous growth of what I will call an unevidence-based wellness industry. I mean, it is really rampant in this country. You can find apps for anything you may want to think about in the wellness space. And we've sadly, as a nation, had rather poor productivity and probably decreasing productivity. We've, of course, had, like every other country, COVID, inflation, the effect of war, and cost of living crisis. But we have, which I don't think is shared to such a degree as other countries, now a benefit system that is very slow, it's rigid, and it has many perverse incentives. And that has been growing over the last 20 years. So what's the result in 2025? I'm not, by the way, a person with a glass half empty. I really am a person with a glass half full, but I think you have to look at your challenges and then say, where do you go? So we have a welfare system that the government will admit is unfit for purpose. We sadly at the moment have a diminishing labour market. We have a real decline in employer confidence to take on new people because they have been hit by a lot of recent regulations and change in the law. Possibly really worrying is our young people and young people going into employment. The increase in mental health, poor mental health in our young worker is really doing only that. Now, I'm not sure whether that is true of other countries, both in Europe and around the world, but it is a big worry to us here. As I've said, productivity isn't going in the right direction. And as Andy Haldane, who was the previous chief executive at the Bank of England, economist at the Bank of England, said that there's clear evidence now, for the first time since our industrial revolution, of poor health really detracting from both growth and well-being. And if you look at our unwanted labour market changes, we have a big increase in economic inactivity. And it is concentrated, when you look at the evidence, quite in our young people, and then in our, shall I say, plus 55. So the two ends of the spectrum. And for the first time, it's driven largely by an increase in long-term sickness. And the trend was happening when you look at the graphs before the pandemic started. So, of course, the pandemic will not have helped, but the pandemic is not the only cause of this. We simply can't explain it all either by long COVID. Long COVID is unwelcome, unwanted, it's a worry, but we can't explain our economic inactivity totally by that. Nor can we explain it by people who are caring, people. There has been increase in the amount of caring that needs to be done by people, of other people. We can't explain it by retirement. And some people said, well, home working will close this participation gap. But it hasn't closed it because, as you all know, long-term sickness is on the whole concentrated in low-paid on-site jobs. So it's not the sort of higher managerial class sitting at home in front of their computers. And unlike other developed countries, economic inactivity is rising in the UK. So I think we can't run away from the fact that, and we have to ask ourselves, is this a UK-specific factor? And if it is, why is that so? So that just gives you a sense of what is unwanted in our labour market. And then just to give you a sense of the health-related costs in this country, so around each year, around 300,000 people move from being in work to out of work with now a work-limiting health condition. The estimated cost to UK employers is £150 billion per year through lost productivity, sickness absence, and recruitment costs. An expected rise in our incapacity benefits, which we simply cannot afford in this country, in real terms, is estimated to go from 20.8 billion a year in 2019-20 up to 32.1 billion by 2029-30. That is more than we in the United Kingdom spend on defence. So these things just simply cannot just go on. And so if we think then about these work-limiting health problems, 8.2 million people of working age report they've got a long-term health condition that limits their ability to work. But I did say right at the beginning that with the right support and the right management and the right leadership, many people with health conditions can be in work and want to be in work and shouldn't have to sit in our benefit system. And the growth in number of our economically inactive for health reasons is 10 times the growth in the working age population. And I mentioned earlier this mental health worry, particularly at the end of neurodiversity, the real desire to make the diagnosis of autism or any variety along the spectrum, and then almost that group of people may not have the same opportunity or ability to be in the workplace. And you can see there between 2019-24, 1.2 million young people, that's an increase of 77%, and 0.9 million older people, an increase of 32%, reported a work-limiting condition. Of course, this is worse in certain parts of our country. This is not evenly spread throughout the United Kingdom. It is differences in health, education, economic conditions shape employment opportunities for people with health problems. We're sitting in Manchester, one of our great northern cities, and we know that the north of England suffers more in this respect than the south. And this, it may not project very well, but it's really just showing you, whichever source you look at, the rates of poor mental health have doubled since 2010. And the sort of goldy yellow line are our young people. And it doesn't matter whether you look at the labour force survey, the health survey for England, understanding in society or health records, it is that growing increase in mental ill health in our young that is a problem, because we really don't know why, if we're being honest. We all have got theories as to why, and we really know what we should do about it and at what stage we should interfere. If you look at the older worker, as Andrew said, I have the privilege of chairing the government's What Works Centre for Ageing Better. We have not had governments that have thought very much about the older worker or really made it clear that they would like to make it possible for people 50 plus to still find employment and to be active for as long as they might wish to be. And so the centre had some recommendations for government. This was for the last government, but I think they're quite relevant to any government, that government should be age positive. We're all living longer. So it is not unreasonable that we might want to contribute for longer, and perhaps should have to contribute for longer. But we don't have any ambitious performance targets for DWP-funded employment support. They don't expect the same outcomes as they do for younger workers. And I think we should be much more age-curious. We should have performance data for health and work interventions broken down by age. We should encourage innovation in this area, which we absolutely don't, and things should be age-targeted. We need interventions that are designed to overcome. Ageism is so rife in almost every country. And some of the things written there are really recommendations to our government relevant to some of the things we already have in train, so to expand our midlife MOT pilot project, etc. But just to really emphasise, it's our young workers and our sort of older workers where we do need to do some extra thinking. This is taken from the Financial Times, but I was so struck when I read this article. It was from March of 2025. It was at the time when the government was thinking about changing some of our welfare system and our benefit system. And I thought what this reporter said, what are needed are roots back into lasting employment, that the purpose of a good welfare system is to protect people from destitution and help them into some form of employment, education and training. But he said, and I would have to agree with it, that a decade and a half, I would say 20 years, of attempts at reform have delivered something that largely underperforms while costing more as a proportion of our GDP. And as he said, the increasing bill is driving rising number of people, many of them young, claiming health-related benefits. Our health-related benefit is far more worth having because it gives you much more money than if you have a non-health related benefit. So if you're going to go into the benefit system, much better to go in through the health related benefit because you get much more money. He says there's little reason to believe that the increase in working age people classed as long-term sick is the product of health problem uniquely affecting the United Kingdom. In other developed economies, health-related benefit levels have fallen or remained flat. Rather, we have a poorly designed UK benefit system. And I just have to say, I very much agree with what he said there. I just thought, I mean, those from the United Kingdom will know what I'm going to say now. They'll know this journey well. And I presume this journey is taken in almost every country of the world from being actively employed, the next box, the green box, sickness, absence, to unemployed, into inactive sick. And this is taken from Charlie Mayfield, who at the moment is doing a review for the government on what the employer should do to help keep people healthy and well at work. I had a similar diagram in my 2008 report, but this is a better diagram. So I've chosen to take Charlie's diagram from his interim report, because I think it shows it better than I did, although in a way the facts are the same, and there's some numbers under there. But this dreadful flow, which I presume happens everywhere, from being in work to health issues and indeed management issues that might take you out of work, for example, lack of manager support, through to leaving your job. Some people do manage to get back, but many leave our labour force and do not return in sufficient numbers. So in the United Kingdom, everything is incentivised to push you in the wrong direction. So, for example, statutory sick pay in this country is so low that you really cannot easily live on it. So if you were a worker, let's say on a building site, and your health issues were such that you were really finding it very difficult to work, and your employer only paid the statutory sick pay, it would be much better for you to have a health-related benefit and to leave work and to just go straight into our benefit system. And the whole problem of that is that is exactly what employers do, because if they say, well, Joe, you'd really be better not having to work with your bad knees and your bad shoulder. But of course, the health benefit is a good benefit, so why don't we send you down the benefit route? That is not a good place to be. But that is the journey that too many people take. What Charlie is trying to do is to think, how do we keep them much more in the actively employed and return them from sickness, absence as quickly as possible, retaining people in work as opposed to looking after them when they're at this end is really, really important. And that is where some European countries do this much better than we do. So if you can imagine, the employer in this country takes the brunt of looking after someone if they are sick. Government is nowhere to be seen at that point, which is quite contrary to what happens, I know, in some other countries. And there's no insurance kicking in at that point in time. As you go down the journey to leaving the labour market, the employer's involvement gets less. So once you've gone from being sickness absent to being now out of work, then the employer has lost contact with that employee, and the government starts to pick up its responsibility. And that responsibility gets greater as we get into our benefits system. But I would put it to you that that's just not sensible, that we need much better collaboration between our government, our employer, the insurance industry, and the employee to keep people in work, because we know once you've been out of work for 6 weeks, every week after that you are more likely never to return. So we have a system that, in a way, it's too much of the employer at the beginning, too little of government, and at the end, the government is supporting vast numbers of people in our benefit system. So I do think, and we've had a good look recently at what some other countries have been doing, that we do need to learn from other countries. This is taken from the Health Foundation's recent commission on work, and this is why I'm trying to summarise some of what they say. They say evidence suggests the UK is underperforming many European countries on work and health, we just do not do as well as our international comparators, and so we absolutely must learn and adapt. And you can see where the UK sits, 1, 2, 3, 4 from the bottom, in looking at employment across Europe in 2022 with and without health limitations. So we do not do well when we look at ourselves in relation to other countries. So the Health Foundation just had some suggestions, which I hope the government will consider, that we really do need early intervention in work, preferably in that first 4 weeks. We need adequate and timely support in the welfare system itself, so that there is much earlier and targeted intervention when people are now finishing sickness absence and moving into not being in the labour market. And our two weaknesses are this rigid all or none approach in our welfare system that you either are healthy or you're not healthy, and this lack of early work related support. And then we have not had long-term commitment. So we've had short-term fixes, and we've been trying all the time to do short-term things to change the situation, and we need a much longer and consistent approach. So I would say, as far as this is concerned, we're a system doing too little, too late, and we have many missed opportunities for intervention. The failure to design good jobs and good work that permits flexibility. We've got varying support. 29% of our employers offer little or no health-related support, and only 45% of our workers have access to occupational health or vocational rehabilitation. And I've talked about statutory sick pay. I've described our benefit system as slow and rather rigid. And we have a thing called the work capability assessment that is simply not fit for purpose. And it creates perverse incentives. And so our focus has been on reducing our benefit bill rather than supporting people staying in work. I then just wanted to look at what do employers think about all of this? Is the health and well-being of their employer their greatest concern? Or are they at the moment in this country worried by other things? And you will see here the things that really worry our employers at the moment is increasing their revenue, reducing operational cost, improving their overall productivity, and health and well-being comes forth in what they're doing. So 36% of employers rank workforce health among their top 3 business priorities, but just 11% had it as their number 1 priority. And people or employers move from the 29% that are usually are big companies where they've got the resources to do things and they can do it in a structured and a good way and try to use evidence-based interventions, moving through to very much more reactive support, some reluctant support, very little training for line managers, moving through to rather informal support, and then through to intensive support. So we know that 29% of employers, mainly our small and medium employers, offer minimal support. And why do they say that they behave in the way they do? It will come as no surprise to you, financial constraint. They say they can't afford to do these things. The cost of providing initiatives on health and work. This plea for evidence of what works and for whom. So in the workplace, will what worked for a construction worker be very different from what would work for an office worker? Many are unaware of best practice. They invest, sadly they often invest in what I call the wellness industry, and they get a poor return on investment. in this study, interventions considered ineffective were absent technology, occupational health, and EAPs. And then we have in this country some wider systemic problems. I just want to concentrate for a moment on the fact that OH is not always seen as supportive. This is taken from Malcolm Harrington's recommendations in a very important lecture he gave over 20 years ago. Malcolm was one of our most well-known and respected occupational health physicians, and he said to his profession, adapt or die. Engage management, talk their language, adapt policy-driven evidence to evidence-driven policy, stop your closed shops, do more research. I would agree with, in fact, all of the things that Malcolm has written there. And my challenge back to our occupational health profession at the moment is, have you really modernized, as Malcolm asked you to do 20 years ago? And I absolutely agree with him. The title occupational health is very off-putting to some workers in this country. We have created an atmosphere where if you're sent to occupational health, it is often to see you on your way out of the workplace, not as a proactive, positive thing that keeps you in work. So I'm interested in that. I just wanted to end by saying that I've always considered in doing this work that workplace culture matters. You can put in all the interventions you like. You will reduce sickness absence a bit. But if you have poor leaders, and if you haven't enabled your middle managers to really, really be people managers, and you haven't engaged the board, not only in their financial concerns, but in promoting employee health and well-being, I believe boards should get proper reports on the health and well-being of their workers. But then, and only then, do the personalised interventions have a place. So often we build with a sort of building on the side that's called health and well-being. We don't build a nice integrated structure where it is absolutely part of what we should do. And this is a somewhat old study. It's from the German-speaking part of Switzerland, an industrial psychologist who I had the pleasure of lecturing with. He showed very clearly that if he was particularly interested in the health and well-being of the middle manager, and particularly in middle-sized and small companies, and did the middle manager health and well-being affect the performance and the health of the people they managed. And so he looked at managers who had no health problems. I've never had a health problem. I've never had a physical health problem. I've never had a psychological problem, and I've never had either one or the other. And then looked at the health of the people they manage. It'll be no surprise to you that managers that themselves have good health and well-being, on the whole, have healthier employees. Of course, it could be that the health of the employee is working in the reverse direction. I'll leave you by recommending that if you haven't seen it, you might take a look at the Health Foundation's Commission. I think this is a good piece of work that was published a few months ago in this country. It's really trying to look at actions for healthier working lives. And I've tried to summarize their recommendations, which is really what I've been talking about. Update and apply best practice in job design, workforce health and retention. And they were particularly keen to make sure you sectorized it so you didn't try to fit everybody into the same bucket. Again, things about early intervention, reforming our statutory sick pay, making a much better use of vocational rehabilitation benefit. They wanted a strong one-year job guarantee for people on long-term sickness absence, so we worked much more actively with those closer to the labour market and deliver a bold new back-to-work offer for people receiving our health-related benefit. I thought I'd end by telling you what our government programmes are at the moment. DWP has a lot of ongoing projects for health and work. Their aim is to reduce long-term sickness related economic inactivity, of course, and there's increased NHS funding, and I must say our Secretary of State for Health, Wes Streeting, is interested in the relationship between health and work. And you will see, and I've just listed some of the things and the programmes at the moment that are ongoing through our Department of Work and Pensions, some of them in collaboration with our Department of Health. My big challenge is, back to them, they don't all fit together. I don't see a strategy that I can follow quite clearly from keeping people in work through that journey that I've taken you on. So my conclusions would be that keeping people in work and healthy and well is challenging, but I do believe it's doable. I believe we know what's wrong. I think we need a much more joined together, overarching strategy that can be converted into an implementation plan that doesn't have to be short-term. It's the short-termism that is such a challenge to us, and then we might be able to lead to sustainable change in a system that is much more fit for purpose, so that we support our workforces and they can give it their best. So I hope I've given you a feel for what it's like in this country at the moment. And maybe you would strongly disagree with me, that's fine too. But we do have a challenging situation, but I think it's up to all of us to try and make it better and get us into a better place.